So today we're going to be discussing gender and race-based repercussions of natural disasters on reproductive health and family planning. I'm Madeline DePino.
And I'm Sophia Hanisch.
So for background, natural disasters have many effects on their communities. They destroy homes, cities, and create negative health consequences. This poster explores 3 studies that examine the intersection between class, race, and health inequities created by natural disasters and also discusses women's difficulties obtaining contraceptives after hurricanes, women's lack of protection during intercourse after natural disasters, and the need for natural disaster planning for sexual health.
So there were 3 studies that we looked at for this poster. The first one examined access to various types of birth control in 3,181 women from diverse backgrounds following Hurricane Ike, which made landfall on September 13th, 2008 on the upper Texas Gulf Coast. The researchers surveyed women aged 16 to 24 from 5 publicly funded reproductive health clinics. They collected data over 2 years and screened for duplicate surveys. The second survey described changes in sexual behavior and reproductive care access in young women receiving family planning services before displacement by Hurricane Katrina in 2005. Researchers collected data for 25 days before Hurricane Katrina, and 55 women aged 16 to 24 enrolled at 2 public family planning clinics. 96% were Black and 62% were employed before the disaster, and the mean age was 22. They interviewed the women by telephone 5 to 6 months later. The third study evaluated the provision of emergency contraceptives before Hurricane Katrina. This randomized control trial compared advanced provisions of emergency contraception with usual care in 370 postpartum women from an inner-city clinic hospital.
And we found that society and healthcare providers rarely consider young women at high risk for potential morbidities during hurricanes and other natural disasters. However, any event that displaces large volumes of people poses a long-term threat to women's reproductive health and well-being. Black women are most likely to lack contraception after natural disasters, and healthcare providers need to focus on this group in disaster preparedness. Pharmacists and technicians can make sure that if a storm is coming, people are stocked up on their contraceptives and other protection. Young women of childbearing age require special attention in wake of a disaster.
So for the results, the first study showed that 13% of women reported difficulties accessing contraception. Black women had more difficulty than their white and Hispanic counterparts. Access to resources is critical to mitigate the disaster's impacts on various groups. Community-based disaster preparedness and response to models address women's reproductive needs and are needed. For the second study, 17% of the women needed health care but could not access it. 2 women experienced unintended pregnancy due to lack of access to care. Relief efforts for disasters causing rapid displacement of impoverished women should include provisions of contraception, condoms, and STI services, and mechanisms to link women back into care. Finally, in the third study, women who possessed emergency contraceptives were 4 times as likely to have used them. Advanced provision of emergency contraception significantly increased use without adversely affecting routine contraceptive use. Providing emergency contraception to all postpartum women before discharge at the hospital is safe and appropriate.
Thank you for listening.